Samantha Bickham is a licensed therapist with over a decade of experience in helping individuals navigate eating disorders, trauma, and maternal mental health. With a background in residential and private practice settings, Samantha specializes in integrating EMDR, acceptance and commitment therapy, parts work, and somatic approaches to support deep healing. She owns a private practice, Calming Tides Counseling, where she fosters a safe and affirming space for individuals wanting to deepen their healing, reconnect with their values, and build a more fulfilling life.
You're listening to the Goalpreneur podcast with Courtney Spaeth, the go-to place for ambitious and driven female entrepreneurs looking to elevate their business and life. Each episode is packed with actionable insights to help you dream bigger, think bolder, and achieve your next level of success. No playing small here, only strategies and encouragement to help you shine. And now, here's your host, educator, personal development enthusiast, and holistic esthetician, Courtney Spaeth.
Hello, Goalpreneurs. Thank you so much for joining me on another episode of the Goalpreneur podcast. I am joined today by Samantha Bickham, and she is another Florida resident. We're enjoying this beautiful Florida weather. It is amazing. But she is a licensed therapist, and today we're going to be talking about eating disorders, past traumas, limiting beliefs, and therapies and strategies to help high achieving women overcome all of that. Not heal. We're going to help you overcome. We're going to give you the tips and the strategies to help you be the CEO of your life, help you navigate past that. So, Sam, thanks so much for joining me on the Goalpreneur podcast. I'm excited to hear from you.
Yes, Courtney, thank you so much for having me here. I'm excited. We have so many great topics today, too.
Oh, we do. I feel like this could be maybe a second podcast. I mean, there is seriously a lot that we are going to talk about today.
Yes.
But I'm going to pass it on over to you. I want to hear about your journey, how you decided on therapy as your career, and just your journey.
Yeah, absolutely. And I'm happy to share about it. So I started in therapy, as we all generally do, and sometimes in our career paths, I think, do a little bit of, because it has to do with maybe our childhood stuff or whatever kind of guided us in that direction. But struggled with anxiety and was always kind of curious about that, and just started exploring a little bit more of like psychology, and found it so intriguing just about how people function and how especially trauma can kind of impact us, or kind of guide us down different paths depending on what we've been through. And eventually kind of found myself working at a residential facility for eating disorder clients. And that's also where I learned a lot of what I know today about eating disorders. And from there, went into private practice. And here I am today, kind of working with individuals that are struggling with past traumas, who also maybe are using eating disorders as like a coping mechanism for those traumas. Um, and kind of just working to help them heal and move through that to be more aligned with their authentic selves.
Oh, I think that's amazing. I think the whole eating disorder thing, it hits a lot more people than what we think, right? I mean,
Yes,
some people are
absolutely.
not ashamed to admit that they've struggled with one, and you have others that they don't want to talk about it at all for whatever reason, shame or
Hmm.
guilt. But I think it's something that a lot of us deal with, and most of the time privately. Like, we feel it's like a private struggle, but it needs to be talked about, because if it's not
Yes.
helped, if it's not taken care of, or you're not given the proper strategies to help move past it,
Mhm.
I mean, it can take your life.
Yeah. Yeah. It is a very serious medical condition, struggle that this can go, and it is a very slippery slope. Um, and kind of the extremes that it can go to with the restrictive behaviors, with if there's any purging that's coming up, over exercising, anything like that. And I think, to go back to what you were saying too, that is kind of because of our society right now that's so health focused, that and that thin ideal is constantly so pushed, that it's eating disorders are almost normalized kind of at this point, right? And so it can be a very isolating experience when we're in this place, when we maybe know something little bit beyond just, healthy eating or clean eating is occurring, to be able to kind of share, express that, and maybe not even knowing where to go with that either. Um,
Mhm, mhm. So, I mean, pretty much everybody knows anorexia and
mhm.
bulimia are
Yep.
the 2, I would say, main eating disorders. Are
Mhm.
there other ones that we just don't really know about? We've never heard of them?
Uh, Possibly, yeah. So there's binge eating disorder, which I think a lot of people also are pretty familiar with. And, people commonly say, like, oh, I binged that show, or oh, I binged on that cake the other day, or whatever that looked like. But that is also a pretty common one. And a lot of the eating disorders, too, and something people don't know, you can kind of go back and forth with them, too. Like if you're anorexic at one point, you might, if you start to kind of struggle again, it might look more like a binge eating disorder, which actually a lot of people don't know either is actually also a restrictive disorder, because you have a restrictive period. And then that leads into, kind of pushes you into that binge where you're overeating and eating past your kind of hunger and fullness, where you're feeling uncomfortable and a lot of that shame sits in. And then there's another one that's called RFID, which is less about the body image aspect and more about like a fear that's coming in. And that stands for avoidant restrictive intake. Um, I think I just said that wrong. Avoidant restrictive feeding disorder. I think are we allowed to cut parts of this?
We're fully transparent on the Goalpreneur podcast. This is real. So
As I
mix up,
continue to say it wrong,
fumbles, it's all the
you
same.
can Google it. It's relatively common, and it starts when you're in childhood, and um, kind of increases. But it's like picky eating, essentially, where you have
Oh,
very
yeah.
limited, but it's to an extreme, where you have very limited variety within your diet, and there's certain foods that maybe it's like a texture thing, or like some sort of sensory kind of reason that you're kind of avoiding other foods that are coming
Oh, interesting. Yeah, I never
in.
heard of that one.
Yep.
I had a in high school. I mean, that was like the mid 90s, and back then it was like super skinny, pencil thin. That was the in thing.
Yep.
Um and completely different than how it is now, I feel. But I think to gain control of my own life, I turned to bulimia. That was
Mhm.
one thing in my life I could control. I
Yep.
mean, my parents were great growing up. My mom, like, she was very critical, and
Mhm.
everything was about body image. um, and So even if I gained like 5 pounds as a high schooler, it's going to happen. I mean, there's a lot of
Yeah,
factors
it's
going on.
inevitable. Yep.
But I think causing trauma, and especially somebody that young, putting in negative beliefs,
Mhm.
bringing up weight,
Yep.
feeling out of control, like I have no control or say of what happens in my life. Um, Bulimia was something I could control. I could control how much I ate when I stopped, and then purging. I think about it now, and
Mhm.
it's gross. Who wants to voluntarily, intentionally throw up?
Yeah.
I mean, you
Yeah.
have the flu and it's like, I can't, I hate throwing up. It makes me feel, and it's just disgusting. But somebody with an eating disorder, it's, is it tied to like also a minor mental disorder?
Well, so for the eating disorders, it actually impacts the reward system in your brain. So at some point, that throwing up is actually kind of a form of where you have like a dopamine boost in it. So it's actually your have hormonal shifts that come in as well,
Mm.
and that's what kind of keeps that going and surpasses that. Like you were saying, like maybe more of that disgust experience when we think about throwing up. That's why it feels so different for them or looks different for them, because in that point, it's more like it's actually alleviating that anxiety that you're feeling after you've eaten. So maybe there's that shame or guilt, right? So then you're like, okay, throwing up feels good now because it's more of a reward. So we've kind of altered that chemical in our brain where using that as a sense of um, like protecting ourselves. It's a defense mechanism. So it shifts that whole process in your brain. While maybe people outside of the disorder, right, are thinking like, nobody wants to throw up. That's gross. It's unpleasant. It doesn't feel good. But in those
Yeah.
moments, it does. And the same for the restricting, right? When, most of the time for somebody that again doesn't have an eating disorder, when they're hungry, maybe your stomach starts to hurt a little bit, or you're constantly thinking about the food, or maybe you're getting a little hangry and you're feeling, like your blood sugar is dropping and you're more irritable and on edge, right? So you go and you eat. But for them, again, that not eating, that avoiding the food actually becomes the reward. Like, oh, I did the right thing that day. So it's actually really shifting that chemical process in your brain, and makes it look and feel very different than it would outside of that eating disorder. And that's why it's always so hard too, because you hear a lot of people are like, well, why don't you just eat? Or why don't you just stop throwing up? Or why don't you just stop binging? And obviously, unfortunately, it's just not that simple, because it's that chemical shift in your brain that's actually causing it, as opposed to, it's not willpower at that point. It's past that point. Mhm.
Yeah, that was one of the hardest things to stop, to be mindful and to stop,
Mhm.
because it was like that
Yeah.
habit. It was like, oh
Yes.
my gosh, I
Yeah.
overate. I know I did. I wanted to
Yeah.
because I can go do this and everything will be fine. But
Yeah.
it's not, I mean, yeah, it's not as easy as just don't do it. Just don't
Exactly.
go to the
Yep.
bathroom. Just eat a
Yep.
little bit. Well, that's not easy either, because
Yeah.
what, emotional eating is tied in there,
Oh, yeah,
trying to
absolutely.
suppress feelings.
Yeah. Yep, there's so many, and I think too, the eating disorders are kind of that perfect storm, because they may start out as, well, I'm just trying to keep off a few pounds, but you keep kind of rewarding yourself in that way, that weight gain, or the thought of having that sadness or that anger, or whatever it is that you've been using to kind of numb with the eating disorder, the emotional eating, right, feels now even scarier than what that might look like to actually, like, keep going and lose the weight, or if you're medically compromised at that point, the
Yeah.
actual emotion or the weight gain or what your body would look like afterwards is more terrifying now,
Mhm.
and that becomes the threat.
Yeah,
Mhm.
yeah. So what would
Yeah.
you say to somebody that is in a high stress job,
Okay.
that they just turn to food? I mean, just to kind of numb out, or alcohol to numb out. What would you say to somebody that is struggling with that wants to shift away and start to deal with what they're feeling?
Yeah, so for that too, I mean, I think, and like you were mentioning before a little bit, right, with those limiting beliefs that are coming up, is there's probably something underlying that stress, right? And then, like you said too, that sense of control that sometimes the emotional eating, or that is that sense where you're managing that emotion, right? You're numbing it, you're suppressing it, you're avoiding it, however you want to identify it in that moment. So with that, we actually have to get you to a place where you can feel like confident enough managing that emotion outside of the food, being able to actually sit with that emotion and that discomfort. And then sometimes too, that's checking in, like, well, what is coming up for you that's making you feel like you can't handle that? Is it you're feeling like you're not good enough, or maybe that imposter syndrome's coming in at work, and kind of working through some of those, like, negative beliefs or limiting beliefs, as we call them, that's kind of promoting those intense emotions and then leading into the emotional eating.
Mhm.
Mhm.
What are strategies that you offer? I know we talked the first time about, is it, uh, I might get it wrong, EDMR? That's
EMDR,
I
very close. Yep.
E what is it?
Eye movement desensitization and reprocessing.
That's it.
Yes.
EMDR.
Yes.
That's it. That's it.
I know it's a
So,
mouthful. Mhm.
educate us. Talk to us about
Yeah, please.
I was gonna say it wrong again, EMDR.
Just get we're on the same page with our with our letters here today. So EMDR is a therapeutic technique that is used. It was originally created specifically for PTSD, but now it's kind of expanded, and that essentially throughout our lives, right, we pick up different beliefs about ourselves, like we're not good enough, or we're ugly, or stupid, or whatever that looks like, right, that have come with different experiences. Like, maybe to bring it back to your personal story with your mom, like maybe you felt like you were never going to be good enough if it was constantly that nitpicking, at your weight, if even if it was just a couple pounds, like you couldn't ever get to what felt like enough, just an example. Kind of throwing you on the spot there. And for that, what EMDR would do is kind of target those past experiences that reinforced that negative belief of I'm not good enough and help you process through them. Because what happens when we're going in those experiences, your anxiety stores those experiences in your brain because that's kind of that message that's like, no, don't do that again. Don't do that again. Don't put yourself in those situations, right? It's trying to protect you, but unfortunately, it keeps kind of bringing up that negative belief. And then we manifest it in our lives too. Like we will show up in relationships like we're not good enough. We'll show up at work like we're not good enough or feeling like an imposter, right? So what EMDR does is it helps us to really process through those and clear those out so that instead of feeling not good enough, we'll think, well, I was just a kid. I was just going through development, 5 pounds was fine because that's normal. I'm growing, I'm hitting puberty, whatever it is. It helps you replace those limiting negative beliefs with more of that, more positive, adaptive information that helps you actually see you for, again, your authentic, genuine self, where you are enough. You are
Mhm.
capable. You've already gotten yourself to where you are today. So EMDR just really hopes to kind of make that connection and helps your brain. Because rationally, right? I'm capable. I've got this. But sometimes when we show up, like maybe on a podcast, for example, we have that belief of like, oh crap, like what if I don't? What if I say the wrong thing? What if I mess up our fit? Who knows? Whatever it is. But rationally, you're like, yeah, I know I can do this because I've done it before. But those limiting beliefs from your past keep coming in and kind of putting up those barriers and might be, causing you to feel like that rush of anxiety or get stuck in your head or stumble your words or whatever that looks like.
Oh my gosh, I feel like you're
Mm.
speaking directly to me. It's like my mind goes faster and then I'm trying to remember
Mhm.
what thought I had. I'm trying to get it out and articulate what I'm trying to say.
Yes.
Fumbling over the words, then you have the sweaty palms, then it's like that fear
Yeah.
sets in,
Mhm.
all the things. So with the EMDR,
There you
I
go.
don't know why I want to say EDMR, EMDR.
Mhm.
Like, talk us through that. When you have somebody that comes in, tells you
Mhm.
this is what I'm dealing with, and you suggest that strategy, what exactly is it?
So, yeah, so that's a great question. So, when we do that and I'm introducing it, it's a form. Let me collect my thoughts here. When you're coming in, and we use what we call bilateral stimulation or BLS for short. And that can look like when your brain is processing information, it's kind of fluctuating back and forth between the two hemispheres. So with bilateral stimulation, you can either be like tapping, back and forth, alternating with your hands on either your legs or your shoulders. Or originally, what was used were eye movements, where you would follow the clinician's fingers back and forth in like a straight horizontal line. And then what that does is kind of it activates those parts in your brain that are holding and storing that information as you're thinking about it, and then allows your brain to actively work through it and kind of store it in a more adaptive way so where it's not constantly being triggered and activated and coming up again. So each time that you're going on that podcast, once you process through that limiting belief of I'm not good enough, you're not going to have that rush of anxiety again because your mind and your body, your nervous system know that you are in fact good enough.
Yeah.
So with with that bilateral stimulation, that's what activates that brain, your brain that's holding that and able to kind of heal it and let it rest, essentially. And we don't necessarily always go straight into that. Before that, you're going to do obviously building rapport, getting to know each other, getting to know the history, identifying where those negative beliefs are, and kind of what are those main memories that are kind of feeding into those negative beliefs that your brain is holding on to. You're going to do different skills to help you be able to sit with those emotions that are going to come up with those negative beliefs as you're doing the processing. So maybe you're doing mindfulness, grounding techniques. Just those general kind of emotion regulation skills ahead of time before you're actually getting into some of that trauma reprocessing.
Okay. Okay.
Yeah.
That's so interesting.
Mhm.
And did you start implementing that strategy right away? Or was it years after you had gotten into your work?
So Actually, I had started right away. When I did my internship, when I was going through, like, right after my master's program, I worked at a children's advocacy center. And so it was a lot of children that were like in the foster care that went through a lot of traumatic experiences, and they had all the clinicians there were actually EMDR certified. Um, and so I loved it, and I wanted to be able to join in on that. And so I actually did a training there at the advocacy center that they hosted. So I've been doing it my whole therapeutic career, essentially. Mhm.
Wow. And do you
Yeah.
notice a better response with that versus other strategies or techniques?
Yes, absolutely. I mean, honestly, it just works faster because I'll even use like acceptance and commitment therapy and dialectical behavior therapy, so ACT and DBT, which are just two other popular therapy styles. And EMDR is just so much faster because those other ones are only going to get you so far. Well, they'll help you kind of manage and be able to regulate and use those mindfulness skills or, identify your values and make values-based decisions and all that really great stuff, right? However, your nervous system is still holding on to all these past kind of negative life stressors that happened to you. And those are still going to have that impact because your nervous system's still going to react each time, even though mentally, I'm fine, I'm safe, I'm good enough. But your nervous system isn't quite on board. And that's where EMDR comes in, where it's actually getting that,
Mm.
it's helping you with make that mind body connection. So it's much quicker, I would say, than those other ones and more effective. Um,
Oh.
and I actually get a lot where a lot of clients will come where they've done like more of the traditional talk therapy and stuff, and they're like, yeah, like it was great, but it could get me so far. And then
Mm.
they'll come in wanting EMDR to really kind of take them, that next step through the healing process.
Interesting.
Mhm.
Huh. Okay. So with working so in your practice, cuz
Mhm.
you see both in person and virtual, correct?
Yes, correct.
Okay.
Yep.
So with your patient base or client
Mhm.
base, is it more high achievers that you're seeing that are struggling the most, or is it just your average person? I
Um,
feel like that's such a poor way to say it.
I
I
get
feel
what,
like
like
it's such a
maybe
poor way
more,
to say
yes.
it, average person. Um, or are you seeing more of like the high achievers, the super ambitious
Yes.
people?
So honestly, I would say I get a good mix because I do have a lot of, adults that are coming in because they are in those maybe higher positions in these organizations and they're have like you know, a, an intense workload. They're working those long hours, and they also tend to where it's a lot of them struggle with what we call hyperproductivity, which is kind of like that perfectionism, struggling to take a break, feeling again like if I were to sit down or rest, or if I weren't performing at whatever those expectations that I have in my mind, or maybe other people have placed on me, then there's that anxiety, or again, maybe those beliefs of I'm not good enough, or I'm failing, or um, I'm bad, there's an
Mm.
unlimited amount of what could be coming in for that, right? But it does definitely very common for that. And generally, those things aren't necessarily bad to an extent, right? That hyperproductivity, if you're doing well, it's just they're not necessarily having that balance. And when they're coming home, when they're with their families or they're wanting to do leisure time or with friends, that maybe there's no room for that. Or they're so burnt out from work that they don't have the capacity for that afterwards. So that is very common, and I do see that quite frequently. Yes.
So that productivity is, from what I'm hearing, correct me if I'm wrong,
Ab-
it's kind of like a trauma response.
Absolutely. It's very much a trauma response. Yes.
So could
Yeah.
that have been something that was set in motion during adulthood or preteen or early childhood?
I would say generally the majority of things go back to our childhood and kind of how that foundation was laid earlier on in our lives. However, I mean, yeah, it can definitely be where it shows up at any point, wherever those life stressors were. Maybe they got like bullied in high school for their bad grades or something like that, right? Or for not being in the honors program or whatever that looks like. So then
Mhm.
now they were like, that hurts, right? They're feeling insecure, they're feeling not good enough. So maybe they take that and they go and they go to college and they're high productivity, or sorry, they're high performing and they're getting that positive feedback for it, right? And that feels good. So then
Yeah.
they're like, oh, okay, I want more of this. So then it keeps kind of reinforcing that, which again isn't necessarily, a negative thing. However, generally with that hyperproductivity is when we're taking it to that next level, where it's becoming a negative experience for us because we're overwhelmed. We're constantly functioning on high stress levels, which can actually even have medical, complications for us with chronic illnesses, headaches, can impact our heart, our stomach, our digestive tract, all of those things, so it does have long-term implications for it too, where it's just not sustainable, if they're not
Mm,
having that work-life balance, as we say. Mhm.
yeah. Yeah. The where are my notes here?
Mhm.
So with past traumas and okay, so past traumas, also dealing with ambition and drive in wanting to create that success. So the high achievers, the
Mhm.
people that just cannot sit still. They feel like if they take some downtime that I'm wasting time. I'm wasting energy. I could be doing something productive or something more to meet my goal. Um, but
Yeah.
that can also, I mean, I don't want to say that can also, but that has a correlation to body struggles and
Mhm.
eating habits.
Yeah.
Yeah.
Absolutely. So with that higher, well, when emotional eating comes in, obviously if there's any body image stuff where or just wanting to be clean or healthy, or again, they're not setting aside the time to um, maybe just honor their body's kind of cues, like their hunger cues, or um, getting in different forms of movement, or whether that looks like in an appropriate way. And then also on the other hand, too, they could be also hyper fixated on their body, right? And that could align with that kind of expectation that they have to be perfect, they have to look a certain way, they have to be maintaining this like physique, or this I don't know, like have this mask on, right? Where they're trying to
Mm,
appeal to whatever it is in their environment, their work environment, or whatever that expectation was that was laid for them, and
mhm.
all of that can lead into stress eating. And also, if they're undernourished, then your body is going to be constantly hyper focused on food in general. So you might be more likely to be mindlessly eating too, like snacking around,
Yeah.
or, quickly grabbing something and eating out on your way home or something like that. So there's a
Mhm.
lot of different areas where that can definitely play in.
Yeah.
Mhm. I've
That's
even had a side note. I've had experiences where some people will use food as an excuse to also take a break, where they're like, okay, well, I can't just sit and relax and decompress after long days of work or during my lunch break because I have all these high expectations that I need to get done. So I'm actually going to use food as a reason to, okay, well, I'm sitting here, I get to eat. I have to actually be doing something that feels productive as opposed to just sitting here and maybe reading a book that's not related to work, or doing yoga, or whatever it is that might be something that's more um, appropriate or needed in that moment for them outside of maybe
oh,
just a normal like meal plan. Hmm.
yeah. Oh, wow. Okay. I didn't even think
Hmm.
about that.
Hmm.
Seeing it from that perspective, like, okay, I need an excuse to sit down. Oh, I'm gonna eat something or I'm gonna have a snack. Never even
Yes,
thought about that.
just giving them permission. Yeah, yeah,
Huh. Okay.
yeah.
So, I can't remember if I had told you during our previous call or not. My husband's a former Marine vet and
Okay, no,
suffered
I listened to you.
loads of PTSD.
Hmm.
And I had met him years after he had gotten out. But so, um, in 2023, he was officially diagnosed bipolar. And so we will be
Yeah,
married 16 years this September. But for all of
congratulations.
our marriage, there were so many red flags and with his PTSD, which he knew.
Mm,
But then also the bipolar part. Since August 2023, he's been on medication. He's been stable, seeing a psychiatrist.
that's awesome.
Um,
Mhm.
but I've noticed, and I didn't really think about it until you had mentioned it, that need to always be doing something. I felt like I always had to be doing something. He does
Yes.
very well with work. He is a high achiever. He always has
Mm.
been. And I noticed it was like my body would tense up when he would come out of his office and I'm sitting on the couch and I have on a
Oh,
show. But
yes.
to him, like and this is things that I'm like, oh, he's probably thinking this, which it's wrong to assume because I don't know.
Yeah.
But it's like, oh my gosh, okay, so I know that I had been on my feet busy all day up until that
Mm.
point where I finally just sat down for like 15 minutes. It was like that point of struggle where it's like, oh my gosh, he sees me sitting on the couch. I should be doing something. It was like that. I've noticed that it was that
Yes.
instant feeling like I need to be doing something productive.
Mhm.
But I
Yeah,
should be giving myself some grace because I know what I was doing up until that point, and
exactly.
I'm allowing
Yes.
my and giving myself permission to take rest without an
Mhm.
excuse. Is that right?
Yep.
Yeah.
Exactly, and I think too, I like that you mentioned that your body tenses up, because that's even like we were just talking about, right? That mind-body disconnect right there. Because rationally, you're like, "No, it's fine, I've been working all day, I know this," but your body is already kind of reacting to whatever that, is ingrained there that, "Oh, he's judging me. He's thinking that I haven't been productive enough or doing enough. I haven't been doing the right thing," in his mind, and you're waiting for that, maybe whatever that consequence might be or that backlash, even though he may never have actually reinforced that, but maybe that's from your mom or, whatever that is in your past that of that constant criticism. You're waiting for that. Your body literally braced itself for that potential threat that was coming in.
Yes.
Yes.
So going back before he was diagnosed and on the proper medication from the psychiatrist,
Mhm.
it was like I would get his backlash
Oh, yeah.
because I was sitting down.
And your
And
body remembers that. Absolutely.
so
Yeah.
is there I feel like I've had to remind myself, kind of retrain my brain, which goes back, ties into those limiting beliefs. But
Mhm.
I feel like I've had to retrain my brain somehow to not tense up, to do those belly breaths to rebalance
Yes.
the nervous system
Yeah.
and to say, I am safe. I'm not doing anything wrong. I'm taking a break for me, but it
Mhm.
is a process.
Oh, yeah.
It's
You
a
have to
process.
actively work yourself through it. Yes. Yes. And I will say too, and something that I generally like to say, right, is those coping skills are really great, but they're like an umbrella in a rainstorm, right? They're good. They're keeping you dry. That umbrella's keeping you dry. It's keeping you okay. But what if a lightning storm, a thunderstorm comes in? Your umbrella is only going to do so much for you with the wind. And if there's lightning, not necessarily the umbrella is not as safe enough. So that's where kind of that therapy or that EMDR piece comes in too, where it's really able to kind of clear out those negative beliefs, those experiences that you had with him in the past before maybe the medication and the diagnoses, right? Because that is still lingering and that's still going to keep reoccurring because it's still kind of stuck in there, frozen in time, essentially, in your mind. And your nervous
Mm.
system is going to keep having that reaction and that response. Mhm.
Oh gosh. Okay.
Yeah.
Um, there was another question that I had, and I had to take a picture of it because it was too much to write down.
I love that.
um, oh, with people that are trying with not just women, but men and women.
Mhm.
So with people trying to balance their careers, families, personal
Mhm.
life,
Yeah.
um, and then they constantly have that struggle of those negative or limiting beliefs kind of popping in their head.
Yeah.
Like, what do you suggest for somebody that's suffering from that? Those constant negative reminders, even though that they know that they're good enough. They're taking great care of their family. They're excelling in their career. They do set
Mhm.
aside, the personal time for themselves. But it's like that voice, those limiting beliefs, those negative
Yeah.
thoughts, that voice kind of gets louder and louder.
Yeah.
What do you how would you help somebody through that?
So me as a therapist or me just giving general recommendations for somebody who's at home trying to help it?
Well, I'd like to hear both.
Oh, okay, that works too. So therapeutically, what we would do would we would use EMDR as my main modality. So we would focus on targeting those underlying negative beliefs. So like, right, if they're going home and they're really struggling to be present in the moment, maybe they're struggling to maybe hold that boundary and step away from work emails or work calls or get their mind from not being, stuck at work or that feeling like, oh, I'm not doing enough, like I'm gonna get fired or they're gonna give me a bad review, whatever that looks like that concern is again, we would figure out what is underneath that. Let's just keep going with I'm not good enough. Okay, I'm not good enough. What emotions does that bring up for you? A lot of stress, anxiety. I feel tension in my body. That flight of ideas, just those constant thoughts popping around in my head. Okay, let's notice that and let's see how familiar that feels. And then we would kind of trace that back with the bilateral stimulations coming in here too, mind you, in the therapy session. And then your brain is going to bring up anything that's kind of associated with that same body nervous system reaction right there. And it's going to take you back and kind of pinpoint other experiences that have felt very similar that kind of initially reinforce that belief of, I'm not good enough. Maybe again, that's that high school experience of being bullied, by some of those friends that were making fun of you for not, getting all A's or getting into that Ivy school or getting into those honor programs or honor classes. And then we're going to process through those memories that of your friends calling you stupid or, whatever those teenagers might have been
Yeah.
doing in that moment, right? I'm sure we all have our experiences where, our bullying times in middle and high school. Um, but you would process through those, and those, as you clear those out, you're going to see that that ability to kind of just be more present at home, and you're going to feel more comfortable and confident in yourself. And you're also going to say, because things are going to happen, EMDR is not there to make life perfect, rainbows and butterflies. Life is going to throw those curveballs at you regardless, right? But EMDR is going to kind of clear out some of this earlier baggage so that whatever does come up, it's not just continually kind of getting packed on top of all that other stuff. So you can more easily have that adaptive information and the capacity to actually be able to handle these new things that are being thrown at you, right? And then on top of that, and this can kind of obviously, so in sessions we would do a bunch of different like grounding techniques for the eating situation. Maybe if that's coming into play, we'll do a bunch of different mindfulness, because a lot of that comes in where emotional eating can be a little bit of a dissociation can be happening in that moment, right? Because that's where that numbing or that avoidance comes from. Um, and I was actually also thinking too, a lot of like that hyperproductivity or perfectionism can also be a form of like avoidance. We're not wanting to just sit and be still, because then all those negative beliefs start to kind of fester and come up too, right? Because if we're
Mm,
working, we're distracted.
yeah.
So a lot of this is going to be able to be mindfulness of being able to be in the moment while regulating yourself and your system, kind of like you said you were doing, right? You did those deep abdominal belly breaths. Maybe you're grounding yourself in the moment. You're looking for the different colors in the room. You're reminding yourself that you're safe. I'm here. I'm on my couch. It's comfortable. You're reorienting your nervous system back to the here and now, as opposed to being back into those times, right, when maybe husband was stuck, in some of those behaviors, and maybe he was yelling or he was criticizing you, because that's where your nervous system is taking you to the past, essentially. So a
Mhm.
lot of just grounding and being able to regulate that nervous system. And that can vary too, just based on kind of the intensity that distress is coming up. Because sometimes too, for like that emotional eating, you might need something that's going to kind of snap you out of it and bring you back to reality, so that you can actually be mindful of those bites that you're taking. How does that food taste? How does it smell? What do you like about it? Checking in with your body. How hungry are you right now? Are you feeling full? Could you use one more bite? Okay, cool. Have one more bite. And after that, let's maybe step aside and go, read a book, do something that's going to potentially take your mind off of it. Stuff like that. And that obviously can
Mhm.
be similarly with uh, like the distress around, any other past trauma stuff too that's coming up, or those negative beliefs, like you said.
Yeah,
Mhm.
interesting. I've noticed that with uh I don't even remember the year, how old I was when I kind of wised up and stopped
Mhm.
bulimia, because I
Mhm.
knew it wasn't a healthy thing for me.
Yeah.
Um, I don't exactly. So I had my oldest when I was 22, so it was probably a few years before that I had stopped.
Okay.
But I have noticed that when I'm eating, I'm
Mhm.
usually the last one done.
Mhm.
And my husband's just, I mean, from the Marine Corps, it's like they had to eat as fast as
Y
possible. So
You have a
he's
time frame.
completely
Mhm.
the opposite. Yeah.
Yes.
And he's like, "You're not done yet? Why are you taking so long?" And like he's a completely different person now after being diagnosed than than
Yeah.
before. I want to make that
Yes.
perfectly clear. Like I
Yes.
talk about the struggles and the trauma and the like our relationship prior to him getting diagnosed. Like I'm very
Mhm.
open about that. I'm not ashamed to talk about it. But with
Mhm.
the eating, I'm like, savor your food. Like enjoy it. It's not just yeah, it's fuel for your body, but like
Yeah,
you're
but
paying
it
good
can
money.
also be a positive experience. Yeah.
Yes. Savor the
Yes.
flavors and the experience and the environment that you're in. Like,
Yeah,
take it all in, and I'm
absolutely.
like, that's being present, that's being mindful.
Mhm. Yeah. And I also think too that like a little add-in for emotional eating, that emotional eating isn't always necessarily a negative either, right? We have cake on our birthdays and holidays and events, and sometimes cake brings in that reminder of like, the good times, the family connection. Maybe you went to get pizza on Fridays with your dad after school, you know what I mean? And you guys had a good time and it was enjoyment. And now eating pizza kind of brings back some of that connection, that positive those positive times that you were having with him, right? So
Mhm.
there's also a lot of like positive sentiment emotionally connected to food too. Food is a big part of our life, not only just for us to survive, but also just as a social, aspect too.
Oh,
There's
for
very
sure.
few things that you go to where you're not going to have some sort of snack or hors d'oeuvre available to you.
Yeah, yeah.
Hmm.
With the therapy, and I'm shifting gears here a little bit,
Hmm.
with the therapy, are you noticing that, um I don't even know how to word this. So, people that are opposed to therapy
Hmm.
for different reasons. Um,
Yep.
they are successful in their career and in life, but they
Hmm.
don't want to admit that there's other areas that they're dropping the ball. Like, do you find that with some clients or patients that some are just more resistant to therapy because they need to put on this face like they have it all together? They don't need
Yeah.
therapy?
Yes, absolutely. Um, I see it a lot where there's some of that doubt in there. And honestly, that's something that would be one of our main things that we would start actually working through and processing is that what are those, like you just mentioned, right? Those barriers that are coming up for them where it feels too vulnerable, too unsafe to be in therapy and actually kind of lean into it a little bit. Because, like you said, there's definitely a reason, there's definitely something up. If it means that they're kind of reinforcing that belief that I'm doing something wrong or that I am actually not good enough because I have to go to therapy to fix something,
Mhm.
or that what are other people going to think that I'm here, that I had to do this or I couldn't do it on my own, that I'm not capable, I'm not competent enough. So yeah, those would definitely be something that would come up and we would want to touch in on and explore as well. And sometimes, it's scary thinking about having to let down those walls and sit with the emotion. You've been putting up these barriers to avoid the emotions for years, right? And you want me to come in and sit and just let them all out?
Yeah.
Yes, definitely can feel very scary and overwhelming for sure.
I
Mm.
mean, do you feel like some people that are so resistant to therapy, I mean, they've created their own walls, their own challenges and roadblocks. Like, I hear what you want to scale in your company or you want to achieve
Mhm.
this next goal or this level of success. But in order to do that, there's things that you need to tackle and to take straight on and to overcome. And then that
Yes.
wall will come down, and then it's like smooth
Yeah.
sailing after that.
Yes. I think, unfortunately, a lot of the times where I see, like anybody that was initially where they were saying like they were resistant to going to therapy and then eventually made their way into therapy was because they've kind of hit rock bottom with that, where maybe it's actually where those struggles now are now bleeding into work related stuff because, or maybe their relationship and maybe their partner is strongly encouraging them to, seek therapy. Or they're doing it for the kids or whatever. It's not really for themselves. There's always kind of that external factor that's pushing them, that they
Mhm.
need to kind of validate why they're going in there. Um, but oftentimes, unfortunately, right, they're having to get to this place where things are pretty difficult right now, as opposed to before where maybe things were starting to kind of, some of those blocks were starting to fall down from their built up walls and things were starting to pour over the wall there from, their past stuff or whatever it is, that anxiety, the past traumas, life stressors, etc. Were kind of starting to trickle in. But then eventually, right, they're just like, no, it's fine. I can handle this because again, they don't want to necessarily acknowledge that things are getting hard for whatever reason until eventually that wall just comes tumbling down and they're flooded by that stuff and they're maybe having panic attacks or they're starting to have nightmares and they're not getting sleep anymore. They're having maybe a chronic illness came in, and they're struggling to function in that way and they're filled with all this stress. There's so many
Mhm.
different reasons, but I keep saying it's unfortunate because at that point, it's a little bit more challenging, right? To start putting those pieces back together and rebuilding when before they were still a little bit more, stable or functioning in their life. So it would have been a little bit more, as a lack of a better word, just I guess easier to kind of slowly go into it because now we're really trying to kind of pull everything back together and put out all these fires, whereas before it was more of little embers here or there that were sparking up, you
Yeah.
know?
Yeah. So what do you say with somebody that wants to have a healthier mindset? They want to stop living in the past and stop dwelling on the the false beliefs that they were told,
Mhm,
growing up into adulthood. Like they recognize that there needs to be a shift,
mhm.
and mindset is key. It's a foundation to pretty much everything.
Yep,
Um, what
absolutely.
are some affirmations that you take people through to help tell themselves a better story?
Honestly, when you were saying that, the first thing that kinda came up to mind was that, we've all nobody makes it out of life unscathed, right? So kind of even reckoning that all that it's relatable in a sense that even though they have this expectation of themselves to have it all together, to be, this perfect superhuman, whatever that looks like, that they're not alone in that. And that also they've already been doing a lot of really hard things. So they can they can do this next thing by acknowledging that they have stuff that's coming up and stuff that could be really beneficial for them to work through too. So
Mhm.
I think some of those things, it's just recognizing that one, they're not alone in this, that everybody goes through stuff, right? They're human. They don't have to show up as this perfect superhuman.
Yeah.
And they can do hard things, absolutely. And that hard thing can be, moving through their emotions that they've been trying to avoid for all these years and
Yeah.
face some of that stuff. Mhm.
Yeah. So, I mean, with affirmations, I feel like I've been reading and seeing more on social media about affirmations, affirmations, affirmations. I
Yes.
can say something till I'm blue in the face, but it's not going
Yes.
to change anything. Like there needs to be that internal
Yes.
shift in order
Exactly.
for what the affirmation to take
Actually
hold.
be Mhm. Yeah. I like that take hold, yeah. And I think again, that goes back to that mind-body connection where, right, rationally, you can sit there and know all day long that you're capable and you're doing the thing, but your nervous system is feeling a complete opposite thing, where it's feeling unsafe for whatever reason. It's noticing those potential perceived threats or waiting for something that's constantly around, that corner, be able to shoot a drop.
Yeah.
Um, so yeah, I agree with you that there has to be, I think those affirmations are great for having awareness and insight. And then you also have to take action and take that next step into, healing that underlying stuff deeper within that you've been kind of keeping and contained in your inner box.
Yeah. So for somebody listening at home or in their car and they're just at their wits' end, like they just
Mm,
are ready to break, what
yeah.
are a couple, like 2 or 3 strategies that they can just do right now just to help calm their nervous system, switch into that parasympathetic mode,
Mhm.
um,
Yeah, look
and
at
just
you.
to put them into I've been learning a lot these past few
Mhm.
years. That will just make that switch for them internally, and not saying that it's going to be a night and day and they're never gonna have any issues, you know,
Yeah,
going
but something
forward
to
from
help them ride
here.
the wave.
But
Mhm.
yes. So what 2 or 3 really great strategies or tips would you suggest?
So for that one is I think always just to find there are so many really great emotion regulation, relaxation skills out there, and finding one that you feel comfortable with and that you can do in those moments. And even if that looks like the deep breathing, and I would say, as you brought up the parasympathetic, that's our rest digest. So that's our relaxation part of our nervous system that kind of shifts us into feeling calm, feeling safe, feeling okay. We're focused, we're functioning, right? And when we're in our more in our sympathetic nervous system, which is where we're more activated, we're in our fight, flight, freeze, we're in our kind of our safety responses. In order to shift out of that into our parasympathetic, we can do those deep abdominal breathing that you were saying, where you're breathing really deep, like you're blowing up a balloon in your stomach, and then doing slow, extended exhales, kind of as much breathing out as you can, because that kind of activates and triggers that parasympathetic, where it's like, okay, we're here, we're having the time to take these slow, deep breaths, we're
Mm,
okay. And those moments too, you can be sipping on water as well, or something sour like gum or like a spicy, a mint or something like that. That's also going to kind of activate your salivatory glands because it's that digest. So we're activating and we're kind of reminding our body we're okay, we're eating. Because when we're in our sympathetic, that means our digestive system is kind of shut down because all of that energy that's going to digesting is now going to our legs and our heart and our arms so that we can either run or fight or kind of shut down and go into that immobilization phase, right? So
mm,
all of these things are things that are getting us of that part, out of that part of our nervous system, out of that. And then kind of staying grounded in the moment is very helpful. So again, that can be um, something as simple as like, tuning into your senses, looking around. What do you see? Maybe that wasn't as obvious to you before. What do you hear? Is there anything that you can smell currently in the moment? What are you physically feeling on your body? Maybe your shirt or the hair on the back of your neck, or if there's a breeze passing by you. You can try picking a color and seeing if you can find as many things of that color around you. All of this is getting you out of your head, out of those thoughts, that anxious part, and into the moment. So you're not thinking about the what ifs of the future or the shame or embarrassment of the past. You're in the moment and you're trying to stay focused and grounded here while maintaining and keeping that nervous system regulated with those deep breaths.
mm.
Mhm.
So many nuggets of knowledge, wisdom.
Yes.
This
Yes.
is
And there's so
so
much
good.
more out there too. So yes.
So good. Is this
Hopefully.
all on your website?
Yeah, actually, I have a lot of really great stuff on this, like information about EMDR. I have a lot of emotion regulation techniques on there and some videos on there too. So, yes,
And
all
it's
accessible right there. Mhm.
www.calmingtidesfl.com.
Yes,
Yeah.
exactly.
Okay.
Hmm.
I'll link that in the show notes. Make it nice and easy. They just have to click it and it brings them right to the website.
Yes. Yeah.
And then for social media, Facebook, Instagram,
Yep. Facebook and Instagram. Yes, I have both of those. I do not have my, I can't even think of what the name is that my names for those are, but they are there and they're also on my webpage as well. So they can
your
click on
website.
that and then
Okay.
go there. Yes. my
Okay.
handles. That's what they're called, right?
Oh, yeah, social media handles. Yes, yeah,
Yes, thank you. We got there.
yeah. Um, okay, so I'll link all of that into the show notes.
Perfect.
Is there anything else that you wanna leave my audience with that's something that we didn't discuss that you're like, they really need to know this?
Um, honestly, I think we touched on a lot of great things today, and I know so much of this could definitely be elaborated on in depth, right? But ultimately, I just hope that they know that they're not alone. They definitely, are not the only ones going through this, which thankfully means that there are ways for them to receive support for this, and there's so many really great resources out there for them um, that are obtainable. Yeah.
Yeah. I've
Yeah.
I've told my sister, I've told my friends, like I said, I'm not ashamed to admit struggles, past challenges, how I overcame things,
Mhm.
my shortcomings, and
Yeah.
challenges that Jeff and I have faced in our marriage. Like I'm very open and talk honestly
Mhm.
about that. And I had been with my therapist before we moved to Florida. I had been with her for about 5 years. I think
That's
it was five
amazing.
years.
Yeah.
He was with his therapist, for I think 3 or 3.5. So
Mhm.
we were very 2 toxic, unhealthy people,
Mhm.
and we needed to fix ourselves or
Yeah.
to get ourselves in a healthier place before we could
Yeah.
even begin to work on a marriage. But I think therapy is, I mean, I've heard it called therapy, counseling. What else is there? I call it therapy.
Yeah. Mostly
Um,
therapy, counseling. Yeah.
yeah,
Sessions. Yeah.
but I think everybody should have a therapist.
Yes, and I think like you said too, a place, to be vulnerable because I would imagine too, I wonder if your relatives feel maybe more comfortable around you because they know that you're safe and you're vulnerable and you own your stuff, right? So then that might allow them to kind of match that energy a little bit at some point. They know that you're open to that. So if they're ever wanting or needing them. And that's kind of the same thing for therapy. Like you get to come in, it's unbiased, no judgment, and you're just gonna
Yeah.
kind of let loose and have somebody there that's just gonna listen and help guide you through it, you know?
Mhm.
And that's
Mhm.
kind of a beautiful thing.
It was, yeah, I think that was the most healthiest thing I've ever done for myself, and it is a beautiful thing
That's awesome.
to know that you're safe in that
Mhm.
space and you're
Yes.
okay to be vulnerable and to talk about your shortcomings or challenges
Yes.
or things that you've done wrong, and
Mm, yeah.
know that
Yeah.
you're not gonna be judged. They're not
Exactly.
gonna judge you for it. They're gonna walk you through strategies and how you can see yourself differently.
Mhm.
I mean, that's what I got out of therapy, how I could find my
Yes.
value in my worth and see myself in a better position or light than what I
Yeah.
had
That you're
previously.
more than just a professional, you're more than just your body. You have so much more to contribute to yourself and others. Yes.
Yeah, yeah. I think if everybody knew therapy is available to everybody,
Mhm.
and just to go in and vent in a healthy way.
Yes.
I think
Yes.
everybody needs to have a therapist on call,
Yes.
on standby.
And I think that's a great point too, right? Because you don't necessarily have to go in and have a specific thing that you want to talk to that day, which is great. We want to have a plan generally. However, sometimes you just need to come in and let loose on whatever just happened that week. If you had a crazy week, and that is 100% okay.
Yeah,
Yes.
yeah,
Yeah.
that's amazing. Sam,
Yeah.
thank you so much for today, for being on the Goalpreneur podcast, for chatting with us, and for talking to us about EMDR. I got that
There we
right.
go.
Yeah. Oh, I was on your website earlier today. It's
Mhm.
beautiful. It's
Oh,
very
thank
clean
you.
and light
I
and
appreciate
airy.
that.
And I felt very, I think with the colors that you have chosen, it's fitting for Florida, the rising
Yes.
calming
Yes.
tides,
Yep.
the blues
Very
and the
beachy.
teals.
Mm.
Yeah, yeah. So it was, and I like looking at websites because it strikes different emotions,
I do
different, it
too.
brings
And
out
it,
different feelings. And on
yes.
yours, it was just like, I could spend a
Thank
few
you
hours
for
on
that.
here just scrolling through.
That is great feedback. Thank you. I appreciate that.
Yeah, I love that.
Yes. Put a lot of
So
effort into that.
yeah. So I will link everything into the show notes
Thank you.
and then your social media handles as well. Are you
Perfect.
on so we mentioned Facebook and Instagram. Are you on I was going to say Twitter again. It's X. Are you on X or YouTube, LinkedIn?
I am on LinkedIn. That's the only other one. Yeah. I'm not
Okay.
on TikTok or X, and TikTok's a thing,
Oh
but
yeah, TikTok. I forgot about that one.
yeah.
But okay,
Yep, no, I
perfect.
haven't bridged that yet, nope.
Yeah. All right. Well, Sam, thank you so much again for being on the
Thank you
Goalpreneur
so
podcast
much
for
for
this
having me.
conversation. It was amazing. And definitely, I feel like we have talked about I feel like we scratched the surface on a lot of different
Yes.
topics, which
Yes.
are super relevant
Mhm,
and all important. But definitely diving into like picking apart different areas of our conversation and really diving deeper. I think that could
mhm.
be a whole other podcast.
Yes,
Yeah.
absolutely. I feel like there's a
Yeah.
few other podcasts in here.
Oh, yeah, for sure. So, all right, Sam, hope you enjoy the rest of your day. Thank you so much again, and we will chat again soon.
Thank you, Courtney. This has been amazing.
All
See
right,
you.
bye.